All right, it's 7:31. I'm hoping everybody's in right now. Are you ready to start, Dr. Greer?
I sure am.
All right. Hi, everyone. Let's get started. I'm Will Alexander. I'm a CKC dog show judge, a retired professional handler, an educator. I try to be an educator, and host of Dog Show Tips. And on behalf of ProPlan, I'd like to welcome you, Pro Club members and others, in tonight's webinar, Optimizing Puppy Development for Breeders. And for those of you who don't know or aren't familiar with Dr. Greer, she's a renowned veterinarian and also a lawyer whose life work has been dedicated to improving the health and well-being of pets. A Welsh Corgi breeder since 1990, has extensive experience in breeding and raising show dogs, and has written a book called Canine Reproduction and Neonatology, a practical guide for veterinarians, veterinary staffs, and breeders. I think most of us have heard of Dr. Greer, but I want to do a few getting to know questions with Dr. Greer before we get started. Are you ready, Doctor?
I hope so.
All right, let's start off easy. In your bio, you say you are a serious foodie. What will be your go-to snack after this webinar?
Well, I haven't had supper yet, so dinner will be pasta, probably pasta carbonara for tonight with a nice glass of wine. I think that sounds pretty good.
That'll be needed, I'm sure.
Yeah, and my biggest weakness is it's chocolate. There's not a meal that goes by without chocolate. I start the morning with hot chocolate every day, and I don't buy the powdered stuff. I'm from Wisconsin. I use real milk in my chocolate. Wow. So yeah, those are my weaknesses. Is pretty much pasta, chocolate, seafood. Yeah, I don't understand people that can live on no carb diets because bread, pasta, beer, and chocolate. I can't go there.
I'm a chocoholic too. I understand. If you hadn't become a vet or a lawyer, what do you think you'd be doing now?
Oh, I would probably have gone into food science, to be really honest with you. I changed my second year of undergrad. I got a little worried about things. My dad had lost his job, and there were some things going on that I thought maybe veterinary medicine isn't going to be my future. Fortunately, it changed back, but I would have been in food science. So I would be that person that was developing those weird food things that you buy at the store now. It's hard to buy regular food anymore because everything is processed.
Yeah. All right. What is your favorite country to visit besides Canada?
Belgium.
For the chocolate.
Well, I might have been Belgian in a previous life. My dad says I'm Scottish, but between the French fries, the beer, the chocolate, and they have these little tiny gray shrimp that you find in the North Sea, and they make them with homemade mayonnaise in a stuffed tomato. Oh yeah, I might have been Belgian in previous existence. So yeah.
That sounds like a good place to visit for sure.
I love Belgium. Yeah.
What about if you had to have a theme song for your life? What would that be? Any ideas?
How much is that doggy in the window? Kind of an old one, but I think you all know the tune. I'd like that to be my walk-up song when I present.
Well, we can do that, Doc. We can do that next time.
All right.
One more, then we'll be serious.
Get serious. Okay.
What is your favorite movie quote?
Oh, it's the Yoda quote. There is no try. What is the rest of it? There is no try.
There is no try, only do.
We do. Yeah. Like I feel like that a lot with my staff is, what do you mean you're going to try to do it? No. We have to accomplish this. This is an important thing. So yeah. And my personal theme that I live by is the answer is always yes, which makes the staff pretty crazy because they're like, we can't do all this.
We can't do that.
Yes, we can. We can't do
things in 20 minutes.
Exactly. We can do 4 C-sections in a day.
All right, hold on, folks. All right. Before we get going on, a few housekeeping items. Dr. Greer's presentation will be about an hour. with a quick message about Pro Club. And then we'll take a 5-minute break, followed by a question and answer session, and wrapping up around 9:30. We have a big group today, so try to keep everyone on mute. We will keep everybody on mute during the presentation. Please enter your questions in the Q&A box, and we will get to as many as we can. And please take a moment to note the difference between the Q&A box and the chat box. We'll be taking questions for Dr. Greer exclusively from the Q&A box, but feel free to use the chat box to connect with each other during the presentation. So guess what, Dr. Greer? It's all up to you now.
All right. Let's talk about puppies. It's my favorite thing. These are my very favorite topic. So here we go. So, of course, we know a little bit about Will. And we are, for many of you, in the after dinner presentation. Like I said, I am going to have dinner later because you don't want me eating first. I'll be too sleepy. So we're going to talk about the summary tonight will be early neurological stimulation versus socialization, enrichment, housebreaking skills, benchmarks of neonatal development, nutrients for eye and brain development, and skeletal development. So these are kind of fun topics. So early neurological stimulation is a program that was really popularized by Carmen Battaglia. He's done a great job with this, and we're going to go through slides of this one at a time, so we can talk about the neurological stimulation that happens in the very, very early weeks between day 3 and day 16 of age versus socialization. Socialization, of course, is getting the puppy out into the public and getting them accustomed to different things. And enrichment is varied options, novel and interesting things, sort of like Sesame Street. You have Sesame Street in Canada, right? I mean, you have it, right? Okay. So it kind of explains that a little bit. So the Super Dog program, or ENS for short, early neurological stimulation, were shown by the military when they were raising dogs to be with soldiers in foxholes, soldiers that were working in really combat situations, that if these puppies were raised with these 5 steps of ENS, that they saw improved ability overall for the dogs to tolerate stress. So they had better heart rates, better cardiovascular performance, stronger heartbeats, better adrenal glands that were more able to tolerate stress, and greater resistance to disease. So those are all things that I think everybody wants for one of their puppies. No matter what their future holds, it doesn't matter if they're going to be a pet puppy, a performance dog, what their plans are. I really think that all of us want this kind of thing for our puppies. And it's really pretty easy to achieve. So like I said, it was developed by the military during the World War, and it was to really improve performance. It's also been called biosensor. So this is a technique that you do once a day for each puppy from day 3 to day 16 of age, and you still do all your regular handling, the play, all the bonding, all the other things that you normally do with puppies. But this starts particularly on day 3, which is at a time that a lot of times if the female is really doing a great job taking care of her litter, that we kind of are hands off. And I know from personal experience that if we're too hands off, that these puppies don't tolerate stress, don't tolerate different settings as easily as if we handle them more extensively. So we know from the Super Dog program that stimulated puppies were more active and more exploratory, that they were better able to do problem solving using mazes, while non-stimulated puppies became aroused, whiny, made more errors, just didn't tolerate those kinds of learning experiences well. Stimulated littermates were more calm, made fewer errors, and only occasionally gave distress signals when they were stressed. And they were less disturbed by or upset by test conditions. So these are all really pretty cool things that we can do. So if you're looking at this dog being a service dog, if you're looking at the dog being a performance dog, no matter what kind of event you're doing, even if it's confirmation, those are all things that I think we would all agree would make a better pet for everybody. So the 5 steps, and these are really simple. And I have both the photograph that we took in our practice. This is the litter of Portuguese water dog puppies that we used. And then the drawings from Carmen Battaglia's website. And I'll give the link to that in a few minutes. It's 5 steps. So step 1 is 5 seconds, 1001, 1002, 1003, 1004, 1005, holding the head directly up above the hips. So just upright. Step 2 is holding the puppy down. Now you don't go whoosh, and swing them down. You just very gently and carefully, with good support of their head and neck, turn them down so that their head is down for 5 seconds. So I just count out loud. I don't use a timer. I just count 1001, 1002, 1003, 1004, 1005. Step 3 is putting the puppy on their back. And it's okay if they wiggle or struggle a little bit at first. They're going to do that, but they'll start to figure it out. Step 4 is on a cold, damp towel for 5 seconds. Now, when my husband does this, he doesn't go get a cold, wet towel. He uses his refrigerated can of Mountain Dew. And as long as he's doing ENS, I don't complain too much about what his technique is. I was at a trade show over the weekend, and there were some families there that raised puppies. And the little boy that I was talking to, he must have been about 9 or 10 years old. He said, I just put him against the cold glass on the window. I'm like, okay, well, that's creative. That's interesting. So there are different techniques of how you can do this. So 5 seconds on the cold towel, and then 5 seconds of tickling the bottom of the foot. You can use a cotton swab. You can use, a toothbrush, a soft toothbrush, any of those things. So basically, it's pretty simple. This is me with my farm dog in her whelping box. And basically, I just take the puppy, hold them head up for 5 seconds, hold them head down for 5 seconds, hold this puppy on its back for 5 seconds. And you can see these puppies aren't 3 days old. They're closer to 16 days at this point. On their back for 5 seconds, tickle the bottom of their foot for 5 seconds. And then the towel that I have that's already ready to go is here in the whelping box. So it's all set down. So really very quick, very simple. Even with a big litter, it just takes a couple of minutes a day. And from firsthand experience, I can tell you that it makes a huge amount of difference in how these puppies do at the show ring, at the veterinary clinic, in their life settings. So I would definitely encourage you, if you haven't been doing this, that you start doing so. And we have clients that absolutely swear by it. They've had really good experiences with it. There also is sort of a move toward using scent introductions. And I think that's kind of interesting too. This is a kit that you can buy on Etsy, and I'm in no way promoting this particular one, but it has 16 scents in it. Including soil and cinnamon and a number of different kind of scents. So again, you don't have to buy the kit. This is something you can make yourself at home by just thinking through some of the different exposures that you want your puppies to be familiar with. But even if you're not planning on doing nose work or scent work with the puppy or search and rescue or whatever, I think it's kind of interesting that people are finding this to be one more thing that they can do to just expand the puppy's horizons. And of course, when they're 3 to 16 days old, their ears aren't open, their eyes aren't open. So really, our only 2 ways to reach them are going to be through touch and through scent. So I think it's kind of an interesting thing. If you're planning on doing, hunting with them, fine, throw a pheasant wing into the mix. You don't have to use what Etsy sells, but you can probably go around your house right now and come up with 10 or 12 different things between spices and just household goods that are safe. Of course, you don't want to expose them to anything that's unsafe, that's toxic, but I think it's kind of an interesting way to approach puppy raising. This is the website that Karma Battaglia has all the information on. So it's easy to find it. You just have to Google search breeding better dogs, early neurological stimulation, Karma Battaglia. And this will come up as a very comprehensive article. So it goes through all the science behind it, a lot more in detail than what we just did here today. But my main goal for doing this is to, if you're not already using it, to introduce you to it. If you are already using it, to encourage you to do maybe one step more by doing scent work with the puppies. It's just kind of fun. Okay, number 2 we're going to talk about tonight is environmental enrichment. And these are my tips and tricks for raising puppies that are socially well-rounded, particularly in light of the fact that we are still seeing puppies coming to the show ring, that people are saying, oh yeah, it was a COVID puppy. We see him coming to the veterinary clinic. Oh, it's not his fault. He was a COVID puppy. He didn't get socialized. He didn't get enriched. And remember, those are 2 different things. But I think that these are some things that you can do, again, very simple things that you can do at home without a lot of expense that can make a big difference. So we're going to talk about some games, some fun things that we can do with our puppies that can expand their horizons. We know, again, from the research that was done, that non-enriched puppies prefer to hide in their crate or in their kennel. They don't want to come out and be socialized. They tend to be fearful. And again, here's the enrichment part, that parks, classes, shopping centers, if you can go to the park where the kids have their play sets, expose them to children as well. Those are all important things. Ball play is not enrichment. Ball play is different. And again, this doesn't have a time limit on it. So it's not the 3 to 16 days of age. This is what you start after the puppies are 16 days old, and they can continue to receive enrichment their entire life. For some of you who may not be familiar with the commercial breeding establishments, at least in the US, there are some requirements with the commercial breeders that they have to have enrichment set up for the puppies. And last weekend we were in Ohio. I went to 5 different kennels that are run by commercial breeders, most of which were Amish. And they do have requirements to do enrichment. They have play yards that are set up that are just incredible. They have all kinds of really fun stuff. I'm going to show you some of the things I do at my house, which are similar to what they're doing. And it's just a great experience for these puppies to have more enrichment. They're no longer just in a cage, in a kennel, 24 hours a day. They get out and play with other dogs. They get out into the yard where they've got balls and toys and climbing gyms and all kinds of really fun things. So puppies can receive enrichment. Dogs can continue to receive enrichment up into their senior years. And remember that genetics only plays a role in about 35% of the development of their personality, their skill sets, their ability to tolerate stress. That 65% comes from management, nutrition, and training. So don't forget that those are really important things that you can impact, but you do want to avoid overstimulation. So don't do the Disneyland thing where they go in and their head just flies off. I mean, it's like taking your kids or your grandkids to one of those arcades where there's 500 different games and they're just like, Don't do that to the puppy. Give them a chance to kind of take this one step at a time. I went to, a number of years ago, I went to a seminar that Patricia McConnell did. She was the dog's best friend person who wrote a number of books, did a bunch of videos, did some really amazing things for dog behavior. She has a PhD in dog behavior and she's from Wisconsin. And she took us all into a room. There were about 100 people at dog camp. She put us all in a room and she turned a boombox on. This was a number of years ago when boomboxes were a thing. Turned a boombox on in all 4 corners of the room, all playing different kinds of music. And then she started tossing balloons up in the air that we were supposed to keep bouncing up in the air and not let them hit the floor. And while she was doing that, she was walking through the room, giving a list of words we were supposed to write down on a piece of paper. And I didn't even know she was talking until the 4th word because there was so much going on in the room. It was so overwhelming to try and sort out what all the sounds, all the things were going on. And basically we were supposed to be able to write down 10 words and then repeat those back to her in spite of the din and the chaos that was happening. The only thing she missed is she could have had popcorn popping. So we were also trying to accomplish that we were taking in another sense, that we were using our hearing and our sight and our sense of smell and all those other things. And basically she was teaching us kind of what overstimulation feels like. So when you take a puppy out in public, you take them to a training class, you go to any of those things, and it is just overwhelming for that puppy. There's new dogs there, and there's toys, and there's this, and there's that, and there's sounds, and there's smells. Just remember that it can be really overwhelming for our puppies. So the better they are able to tolerate stress, and the better you are able to introduce them slowly to those things so that they don't go into a room that's absolute chaos, the better. The first time you go to a dog show, it shouldn't be the noisiest, biggest dog show that you have in your community. You should start off in smaller group settings where you've got classes that you can slowly get those puppies used to those things. So these are some of my fun things that I like to do. This is a little French bulldog that came to our practice, and he's kind of an interesting little dog. He was a singleton. So you know how singletons are. They can be a little bit difficult. And he was being raised during COVID. His owner was working from home. It was a new experience for her. And she was trying to keep this puppy busy while she was on her Zoom calls. So we set up this muffin tin, and I use a muffin tin quite a bit for all these things. And essentially what you can do with this is a ginger snap that is, come on, I want to play the video again. A ginger snap that is stuck to the bottom of the muffin tin with peanut butter. You can use cheese. Now, ginger snaps are 2-sided. One is flat, one is curved. So when I first start doing this with a new puppy, I put the curved side down so it's easier for them to flip the ginger snap up. After they get a little bit more experienced, I'll stick it down to the bottom of the muffin tin with the flat side down. And this will keep a puppy busy when I'm in the exam room and trying to talk to a client about housebreaking, or you're on a Zoom call, or you're trying to make dinner for your kids and all this stuff is going on. This keeps the puppy busy for a long time. What I also like to do with these muffin tins, and please use the metal ones, not the silicone ones, because I don't want a puppy having these in their crate that's silicone, is you can take yogurt, chicken broth, anything that you can mix the puppy food with, mix their regular chow, the amount that they should eat, with that yogurt, chicken broth, ice, just whatever you want, put it in the freezer. And then when you go to work in the morning or you go to do your Zoom calls or whatever you need to do, pull the tray out of the freezer, put it in the puppy's crate. And now the puppy, instead of spending 30 seconds eating their breakfast or their supper, is going to spend 30 minutes because they have to lick it and wait for it to thaw and get a little more and get a little more and get a little more. Easy, inexpensive, very safe for the puppy. A really great experience for them. And it will keep you a little bit more sane when you're trying to take a shower or run an errand or do whatever. It's just a really fun way to keep puppies occupied. Of course, they make muffin tins in different sizes. You can get the little ones, you can get the big ones, you can get a 6, a 12, whatever works for you, but not the silicone ones. Please stick to the metal ones. And if you get 2 or 3 of them, you can have one in the dishwasher, one in the freezer, ready to go, so that if your neighbor stops by, that you've got something you can pull out of the freezer and just pop it in front of the puppy. You don't have to plan too far ahead. Additionally, we see all the licky mats. Those are kind of fun. Those silicone mats that you can smear peanut butter, spray cheese, cream cheese, any of those things. And a lot of the companies now have upgraded it. So it's not just a flat silicone mat. For instance, this one, a silicone mat will fit into this. And because of the frame, it keeps it stable and secure for a longer period of time. So it's less likely to scoot around. And it's less likely that the puppy can pick up the edges of it and chew on it. So I don't leave these unattended with the puppies. I think a muffin tin is safe. I don't think the licky mats are safe to be left for the puppy unattended. And then there are these snuffle mats. Now, I think these are kind of fun and kind of interesting, but I went to a lecture that one of the speakers said, I've decided that the snuffle mats to hide their food in is not a good idea, because when I was selling puppies to people, they were coming back and saying, okay, he goes out in the yard and he spends his whole time out there snuffling around in the grass, trying to find something to eat or to lick up. And so they feel like maybe they don't want to teach this. So I guess it depends a little on your breed, depends a little on what your expectations are for that puppy. If you don't want them nose down, going around the ring in conformation, trying to find the next piece of hot dog, you might want to avoid the snuffle mats. I'll tell you, after showing corgis for 35 years, showing dogs with short legs is really hard, because everything that was left in the ring from the previous group, hair, hot dogs, cheese, whatever, it makes it pretty hard to keep the puppy's nose off the ground because they're already so close to the ground anyway. And then there's all kinds of fun games that you can buy. The one thing I didn't include on here, and I probably should have, is the Stachios. And that's a round ball that sits in a round disc. And you can put a liquid in the chamber underneath the ball, and it'll, as the puppy licks on it, it'll pick things up. And of course, these games you can buy online. You can buy them at the pet stores. There's a jillion kinds of games. Some are more advanced than others. Some dogs like them better than others, but there's all kinds of games out there for people. If you're willing to spend a little bit of extra money. The nice thing about a muffin tin is it's $1. The nice thing about the licky mats is they're $2. So they're not expensive to buy. Other things you can do, this is a child's sandbox, but instead of putting sand in it, they put water in it. So you can use a wading pool for the same thing. And then they put little rubber duckies or little balls in it that can float around. The puppy can play with them on the outside of the pool. They can get into the water and play with them. If you have golden retrievers, Labradors, it's really fun to give them the introduction to this water kind of experience. Now, one of my very favorite things that I have been doing is feeding fruits and vegetables to my puppies of a variety of different things. Remember, garlic and onions, grapes and raisins, not a good idea. This is a litter of farm dog puppies and a litter of corgi puppies. They were each purebred litters. Just to be clear, I had 2 litters at the same time. So I put them in the pen together. And then I took honeydew melon, cut them in half, scooped the seeds out, and then cut them like a grapefruit so that they were sort of cored out, and threw the honeydew melon into the X pen with the puppies. And oh my gosh, they absolutely had a blast. I had one client that bought a puppy from me out of this farm dog litter, and she called me a year later and she said, "Did you give the puppies cantaloupe?" And I said, "No, but I gave them honeydew melon." She's like, "I cut a cantaloupe today." And Ember went crazy. So they really do have fun with these. So this is just, a very easy way to give the puppy something to do. This is my set up on my sun porch where they've got the honeydew melon, they've got their little play set, they've got all kinds of things going on here. So there's lots of fun things that you can do for not a lot of money. This is another favorite thing. This is my little dog Mouse, and I threw some cherry tomatoes on the floor. So they roll around They're fun to play with. If she eats them, it's fine. And she was just having an absolute ball, batting them around. Now, of course, it doesn't show up as well on a red rug as it does on the floor. But again, it's kind of fun to watch. Just really simple things that you may not have thought of can be really engaging and really fun and keep the puppies stimulated and give them something new to do. So kind of fun stuff. All right. Like I said, this is sort of a play set on my sun porch. So we made this out of PVC tubing, and then I hung a number of different things, and I'm sure you've all seen some variety of this. They're easy to build yourself. If you want to purchase them, of course, you can do that as well. This is a string of tennis balls. That's a mirror hanging there so that the puppies can see themselves. And I put things up that made loud noises that clanged together, metal spoons from the kitchen, a variety of things. We just went to the hardware store and bought the tubing, the connectors, and then really had a lot of fun putting this together. And you can, of course, vary it with each litter depending on what you want. You can make them tall, you can make them short, you can add more things. We cut bottles open and put food in them and let them spin around. There's just a no end to what your creativity can do. And this is also kind of fun. This is a rabbit hutch. And these are my farm dogs. So I bought this rabbit hutch, and if you look, you can see that there's a couple farm dogs inside it that have gone in there on their own. And then they can get up on the roof and walk around. Now, my corgis aren't very good at this kind of stuff. I have to worry a little bit that they're going to fall off. The farm dogs are more agile, so I'm not concerned about that. But again, this is just really a fun play set. Now, eventually they're going to do some chewing on this because it's made out of wood, but it's not terribly expensive, and you can spray it with bitter apple or something to keep the chewing to a minimum. But just gives them a variety of things that they can do, surfaces to climb on, just some kind of fun things to do. Then also I've done things like I've built little baby agility sets. So you can purchase just that plastic decking and make those. You can see that we have lovely winter weather in this video, not unlike what you probably have. We got another 16 inches of snow the other day. And then one of my other favorite things to do are children's toys. So this is a wading pool and then a little kid's push toy. So fun things that they can do, climb on, do things. So really fun things to do. So surfaces are another thing that I really like to focus on. At one time, I went to Walmart and bought 2 of every bath mat that they had. They had 11 different kinds of bath mats for under $10 a piece. So I bought 2, one to put in with the puppies and one to demonstrate other things with. So one of the things that are great about the bath mats is when the puppies are really young, you can put those underneath them. They have a mesh, so urine will run through them. They won't let the puppies lay in any urine. Heat will come through them so the puppies stay warm, but it gives them better traction. And we know that kind of hip development that we need to reduce the incidence of hip dysplasia can really make a difference. So it's not just surfaces for socialization or experiences and enrichment, but it's also good for hip development. So there are some things that you can do with that. So at any given time, you can probably go to your local store and find the same thing. You can see that this one has bristles on it. You can see the mesh ones that I use underneath the puppies when they're very, very young, just a couple of days old, so that they get good traction under their feet, but the urine drains through, so I don't have to worry about them laying in urine. Here's a bristly one. Here's one with square holes in it. Here's some with slats, some that are more of a mesh, some with bigger holes, some with smaller holes, some that are shiny, some that are not shiny. So just a whole variety of things so that they all it was all different to look at. It felt different. It moved differently. You can put them in and out, and they wash in the washing machine, other than this rigid one with the slats on the right-hand side here, that you can't put in the washer because it won't flex. But all the other ones, if they get soiled, they get urine, stool, whatever on them, puppy food, throw them in the washing machine, hang them up to dry, and you can really keep the puppies engaged with a lot of different things for under $100. Another fun thing is just to put them in front of a mirror. So you can buy full-length mirrors at the store for around $6 to $10. Place it outside the X-Pen so the puppy can start looking at themselves. Another fun thing to do. And then teaching them unstable surfaces for stability. You can buy this exercise rocker board. You can make rocker boards. so that the dogs have some variety as well. Here's baby agility equipment you can buy. You can make it yourself, just depending on what you want, so that the puppies learn to use the teeters and the A-frames when they're really young. And they're very confident on these surfaces. They're really pretty fun. The other thing that's fun are those PVC, the big PVC plumbing piping that you can put down. And I'll put that down, and the puppies will go inside, crawl inside of them and sleep in them. So fun. And then this is really kind of funny, is I go to garage sales, rummage sales, whatever you call them. Or you can oftentimes things sitting along the curb that people threw out and they don't want. So I'm that person that stops in the unmarked black minivan and picks up kids' toys on the side of the road, take them home, wash them up, and give them to the puppy. So on the left-hand side is a bowling set. The middle is that kid's lawnmower. On the right-hand side is just a toy that makes some noises. On the left-hand side, that's a children's bathtub with a mesh netting in it. So again, the puppies could go in it and hang out. On the right-hand side, that's a musical instrument. And again, other children's toys that make noises, move funny, they're brightly colored, they're fun. So just some kind of fun things that you can do to give the puppy some variety. On the left-hand side is a walker for children. And then on the right-hand side is a kids enrichment center for children. Now, this won't work. The enrichment center isn't sturdy enough for Labrador puppies when they're 10 weeks old, but it's fine when the puppies are first opening their eyes and starting to walk around, and they can see this, and it's soft, and they're not going to bang their head on anything. They're not going to hurt anything. It's just a nice experience. These are the A-frame and the dog walk. You can see it's been slightly remodeled by the dogs chewing on it. And these are children's chairs that, again, you can buy on Amazon. They're meant for kids to sit in. The puppies love these. They'll sit in them. You'll get 2 or 3 of them in there, and they'll be rocking, and they'll have each other, kind of up and down and all around. Again, $20 a piece. And like I said, these are the kind of enrichment centers that you can build yourself. You can buy on some of the websites, but you're really only limited by the toys that you're willing to put up. They used plastic chain. This is quieter than the metal ones that I used. I like the metal ones because I like them to have some experience. I like wind chimes above their head. I like all those things. Anything you can do to just expose the puppy to a number of different things. It's going to make a big difference down the road. And then, of course, we want to remember that we should give them a job for what they were meant to do. So whether they're a hunting dog, on the right-hand side, of course, is a bear dog, treeing either a bear or a coon, a hunting dog, a herding dog. So just remember some of these experiences. I was watching a video yesterday of some puppies that AKC put out that basically showed puppies that were 7 weeks old pointing. There was a frog on their deck, and there was a litter of 6 puppies, and they were already pointing when they were 6 weeks old. So it's really pretty fun to watch these dogs' brains development. So the other trade-off here, though, is how do you socialize a puppy before it's 16 weeks old and has its complete vaccination series without running the risk of the puppy being exposed to infectious diseases? So those are the trade-offs, the balances that you have to try to achieve. I had a dog in the practice today that is 6 months old, and he has not developed antibodies to canine distemper. He has to parvo. He's been vaccinated multiple times, but his immune system has not responded to the vaccine by producing a titer to distemper. So how do you exactly trade off? Should that puppy go to dog class? Probably not. He shouldn't go to the dog park. He shouldn't go to a dog show where there's 1,000 dogs. He probably shouldn't even go to a puppy class with 8 puppies in it because of the risk of picking up canine distemper. So hygiene is really important. We want to make sure that we keep our kennels clean, that we keep the puppies safe, that we really do practice good hygiene, because no amount of vaccination and deworming can adequately compensate for poor hygiene. So it's super important that we clean the kennels well. When you are cleaning kennels, you want to make sure that you pick up all the organic material, meaning feces, toys, dog food, all that stuff. Get it picked up, get it cleaned, clean it with soap, a detergent first, and then use your disinfectant, and use good hygiene for these puppies so that they are kept protected and safe. Hygiene also means don't let people come to your kennel or your home if they are around sick dogs. They should take their footwear off when they come to your door. They should take off their outer clothing when they come into your house, if you let them in at all. A lot of people are using Zoom as a good way to screen people that want to buy puppies from them. I think that's a great idea. I do it because we have people that live so far away that they want to meet the puppies before they make a commitment to buy a plane ticket to come buy them. So Zoom's a great way to keep people out of your home until things are safe. Hand washing should be done with soap and water. Disinfectant, alcohol-based disinfectants are not enough. Use good soap and water. If people have been around sick dogs, they shouldn't come to your home. If you have sick dogs, you should take care of the sick dogs last. So always take care of the healthy dogs first when your clothing and your shoes and all those things are the cleanest, and then move to the sick puppies later. And like I said, make sure you've removed the organic material, and you know that trade-off is how important is it that we socialize puppies versus keeping them so sterile and so clean that they never have any exposure of anything. And it's a definite trade-off. It's a challenge, but keep your ear to the ground. If there's an illness that breaks out in your community, if there's kennel cough, if there's parvo, if there's anything going on, stay home. Do I go to dog shows when my dogs are pregnant? I absolutely do, because I go to work every day and my dogs are going to be exposed to dogs that I'm around every single day. So I'm not quite so fanatical that if I have a pregnant dog, I don't go out in public. I can't do that and still make a living as a veterinarian. But it is a trade-off. So just be aware. And if I'm around sick puppies, if I think I'm around puppies with parvo, puppies with herpes, when I walk in my house, my shower, I go straight to the shower, shoes off, clothes off, straight into the shower, never touch the puppies until I'm dressed in something clean and ready to go. And I have a washing machine and a dryer right inside the door at my house, so I can really quickly get from the garage into where my laundry needs to be done, into the shower and so forth. So just be really careful with that. So remember, vaccinations. A vaccination is a vaccination. It is not guaranteed that the dog has immunity just because they're vaccinated. So be careful with that. And remember, when you are vaccinating, just so that we sort of digress a little bit here, I want to make sure we don't overlook the medical parts of this, is we want to make sure that we're using quality vaccination products. Zoetis, Boehringer Ingelheim, Merck, Elanco, those are great vaccines. Neopar is not one of my favorites. It's on the slide just as something to mention, but I'm pretty careful that I use Zoetis, Boehringer Ingelheim, Merck, or Elanco vaccines. I think those are the safest and the best on the market. If you are vaccinating puppies yourself, that's great. I have no problem with that. But be very careful how you keep your product. It should be kept refrigerated in your refrigerator, not on the door of the refrigerator, where every time you open and close the refrigerator, the vaccine changes temperature. But you also want to make very, very certain that the vaccinations do not freeze in your refrigerator. You may have a cold spot in your fridge. And we actually had a situation about 10 years ago with vaccine that was shipped to us in the wintertime that apparently had gotten frozen during shipment. It came from Omaha to Wisconsin, and it froze in shipment. And it was so cold during that shipment that it changed the vaccine. And we had dogs that were developing injection site reactions about 4 hours after they were vaccinated. They would develop, it was almost consistently a young female terrier type dog under 20 pounds. And within 2 to 4 hours of the vaccination, she would develop a swelling at the injection site to the point that when you touched it, she would scream. And 2 of them were my dogs. One was a corgi and one was a farm dog. And these were dogs that were not particularly wimpy dogs, but it did cause this really interesting reaction. So be careful with the temperature at which you store your vaccine, not too cold, not too hot. And if you're doing this yourself, put a thermometer next to the vaccine in your refrigerator so that you can monitor the temperature. So put it right with the tray of vaccine. If you do have outdated product, I know there are people who are tempted to use outdated products. Using outdated vaccine is a very bad idea because it may not have the efficacy that it should. So buy the amount of vaccine you need, use it, and don't use outdated vaccine. Next, when I am vaccinating, I always use the same injection site. So in my practice, there are 6 doctors in our practice. Distemper vaccinations always go over the right shoulder. Lyme vaccinations go over the left shoulder. Rabies goes in the right rear leg. So we can keep track. If there is an injection site reaction, when you call the company, and you should, if you do vaccinations yourselves, even if you do it yourself, and you have an adverse event, that should be reported to the vaccine company because they can't keep track of that if you don't report it. But if you get a lump at the injection site and you know that you always give distemper over the right shoulder, you can be a lot more relaxed and calm about what's going on if you know that's where the injection was, that it isn't something else more serious going on. Do not vaccinate your puppies more often than every 3 weeks. There are some vaccine protocols that we see mostly in the commercial breeders, so probably not many of you on the call do this, but we do see some people that vaccinate more often than every 2 to 3 weeks, and that does not allow the immune system to respond. So don't vaccinate more often than every 3 weeks. The puppies need time in between for their immune system to respond to the vaccine. If you do it more often, you actually suppress their immune system and don't allow them to the vaccine to work and do what it's supposed to. And like I said a couple of slides ago, remember to stay attentive to outbreaks. So if you hear there's parvo, you hear there's distemper, you hear there's bordetella, parainfluenza, whatever, make sure that your dogs are up to date on the vaccines that are currently being, that there's current diseases going around in your community. Now, one of the things that you can do if you are not a fan of frequently vaccinating puppies, or you're concerned about over-vaccinating, or you have had a line of dogs that doesn't respond well to vaccines, you can do a test called a nomogram or a nomograph. So a nomogram or a nomograph takes the titer, which is the blood test that we use to determine if there's been a response to the vaccine. It's a blood test. It's testing the blood of that puppy or the mother to see what the antibody levels are. It will tell us by using a nomogram, we test the mother when she's not within 2 weeks of having the puppies. So you can do it at the ultrasound. You can do it after the puppies are born, but not when they're within 2 weeks of birth. We draw a blood sample on the mother. We send it to the diagnostic lab, and they can tell us, the lab we use, I'll show you the slide in a couple of minutes, will tell us when the puppies in that litter need to be vaccinated. Now, it's only good for that female for that litter at that time, because every other litter from the same mother may have a different antibody level. So it doesn't apply to her next litter. It only applies to that one. But basically, it tells us how to customize a vaccination protocol for that litter of puppies. So typically, when we don't have a titer and we don't have a nomogram, we vaccinate puppies at 8, 12, and 16 weeks. It's sort of a shotgun approach. Really, puppies don't need 3 vaccinations if they're given at the right time. The problem is if they have antibodies from the mother, from the colostrum, from the milk, then, and their titers are too high at the point that you give the vaccination, say when they're 8 weeks old, they may not respond to that vaccine at all. So you have to repeat it, which is why veterinarians and breeders give vaccinations multiple times. You don't actually need multiple if it's given when the titer is low enough that the dog can respond to the vaccine. So this is why we see vaccine failures, is if the vaccination is not given at the right time. Most people don't titer their puppies because they don't want to start drawing blood when the puppies are 4 weeks old and draw blood every 2 weeks to see when they're going to respond to a vaccine, which is why we do this approach. But if you're concerned about vaccination, it's really pretty simple to do this nomogram. So you just have to have your veterinarian draw the blood. You send it to the diagnostic lab, and they can tell you, they can customize the vaccination protocol for that litter. So it's really pretty cool. We use it pretty extensively in our practice. So it, like I said, the female can't be tested within 2 weeks of whelping because all of her antibodies at that point are being pulled into her mammary glands to produce colostrum for the puppy. So you're going to get an artificially low titer on her at that time. So we know from the studies that have been done is that the titer will decline in the puppies 50% every 2 weeks. So we can graph it, see where she is, see where they need to be to get a vaccination, and go from there. So the CAVID lab is the lab we use. A parvo titer of greater than 1 to 20 is protective. A distemper titer of greater than 1 to 4 is protective. So this is how the nomogram works, is you send the blood on the mother to the diagnostic lab. They measure how high your titer is. One of these is distemper. The blue line is distemper. The red line is parvo. And when that titer drops below that green line, that tells us the age at which the puppy should be to be vaccinated. So this puppy can be vaccinated according to this. So it's a really cool way to do this. The CAVID lab is here. And again, this is being recorded, but if you have your cell phone and you want to grab a quick picture of this slide, that's great. If you don't and you email me, I can send you this information. So we're happy to do this. So this is the diagnostic lab in Wisconsin. And to my knowledge, this is the only lab that does this testing. Now, there may be a lab in Canada that I'm not aware of, but this will give you the information that we're looking for. It's Dr. Larson's lab. She took over from Dr. Ron Schultz. Some of you may be familiar with his work. Okay, the other thing that I want to talk about hygiene is parasite control, and I think we've talked about this in the past, so I'm just going to briefly touch on this. The important thing for this is more people that live in southern more southern parts of the world than Canada. When we get into the southern tier of the states in the US, we see more parasite problems than we do even in Wisconsin. But fenbendazole is safe to give to pregnant females if you give it between the third week before she has the puppies to the second week of after whelping. So it's 5 weeks, once a day for 5 weeks at the standard label dose. You will prevent the migration of roundworms through the placenta and hookworms through the mammary glands and into the puppies. So this protocol will allow you to have parasite-free puppies. If you've purchased dogs from the southern U.S. and you have problems with parasites, or they brought it into your yard or your kennel, this is a way to kind of break that cycle. I mean, it will not prevent Giardia because Giardia doesn't migrate through the placenta or the milk, but puppies can be exposed to Giardia really as soon as they're born. If the female had some loose stool, she went outside, she got some on her pants, on her tail, the puppies crawled around trying to find a place to nurse, and they crawled through some of the diarrhea. Puppies can get Giardia when they're pretty young. So this can be used as an alternative to routine deworming the puppies. All right. The next thing we're going to talk about is advanced housebreaking skills. And this, again, is a trick that I've been using for a long time, for about 25 years. We've been litter box training our puppies. The last time I went to one of the commercial breeder presentations, I presented this. And of all the things I talked about health-wise, this was the one thing that most people were drawn to, that had most questions about. So it's a really fun technique. I use horse bedding. It's these wood pellets that you can buy at the farm stores. You can buy pelleted newspaper. You can use pine shavings. Pine shavings tend to stick in the coat of long-coated dogs. So Sammies and Goldens and Corgis, they're kind of messy, but the pellets don't do that. I've also had people ask if the puppies eat the pellets, and I've been using this for a very long time, and I've never had a puppy eat the wood pellets. So I wouldn't say never, because Labradors will eat anything, but I think the risk of having a puppy eat this and causing them a problem is pretty small. Now, when my puppies are really young, I put this paint liner in a paint pan. And the reason I use a paint pan is it's small, and those metal paint pan legs will flex out, and I can make one end very low. It's only about 3/4 of an inch high. The other end of the tray is about 2.5 inches high. So the puppies, even my little tiny short-legged 3-week-old Corgi puppies, can get into the litter box and use it. So I use this metal paint tray, and I use the disposable liners. I can buy 3 of those at my Walmart for $1.88. So if they get soiled, I can just throw them away. So I put the metal paint pan down with the liner in it, and then the wood pellets in it. And the puppies, if you give this to puppies between 3.5 and 4 weeks of age, puppies will almost always automatically litter box train themselves. If you wait too long, so if you've already got puppies at home that are 6 weeks old, it's probably too late. So this is my setup at my house. This is my whelping box with my heated whelping nest in it. That's that black circle. The black circle now, because the puppies are 3.5 weeks old, they don't need the additional heat. So I've unplugged it, but I put my litter box tray in there. You can see the legs of the paint pan are flexed out. The wood pellets are in the disposable tray. Then they have a little bed. And then next to it, that white mat is the bath mat that I bought, the shower mat that I bought to put in there, so that if they do lay on it, they stay dry. And then you'll notice beyond the whelping box is a bigger tray. That's a washing machine tray. So that's the tray that you put your washer in case you're worried that it might leak onto your floor. I use that because my females that were litter box trained as babies will use that as adult dogs during the night. So if I have a female, because she's eating and drinking 2 to 4 times her normal amount, she may have to go outside during the middle of the night, and I might sleep through that. So she'll get up, get out of the whelping box, go over to her litter box, the litter box like she was trained to go in as a little baby, and she will use that litter box as an adult dog when she has puppies. Do I routinely have a litter box for my dogs? No, but there are people who do, and it's perfectly fine if that's the lifestyle that works best for you. But I'll tell you that this is a real godsend. Instead of waking up in the morning and finding 2 puddles of urine and a big pile of stool on the floor, I have a nice litter tray that I clean up from the female, a nice litter tray from the babies, and it works really well. Now, the boys aren't quite as good as the girls about using the litter tray. The girls will urinate and have stools in the litter tray. The boys will have stools in the litter tray, but they tend to put their front feet in the tray and have their back feet just on the edge of it. So they urinate kind of close to the litter box. You know, it's sort of the way guys are. So sometimes we see that happen. So this is how it looks with puppies in the box. I've got the bath mat, I've got the litter tray, I've got their little bed, and then I have mom's litter tray beyond it. So this works really well. Again, this is another picture of my corgis in their whelping box. The black tray doesn't work quite as well in the paint pan. It tends to be too easy for the puppies to get it out of there and scoot it around. So I like the white trays, the ones that fit tighter to the paint pan better. Next for housebreaking, I think that there's some pretty fun things that people are doing with bells at the door. Now you can buy just a regular bell. You can buy these very basic ones. This is the low-tech bell at the door. You just take a bell and hang it on a strap on the doorknob so the dog can jingle the bell when they need to go out. And it's really fun to teach the dogs this so that they can ask to go out, because if you're busy on the phone, you're busy at work, you're busy making dinner, and the dog needs to go outside and they just sit and stare at you with their little brown eyes, it can be really hard to know that the puppy is asking to go outside. So having a bell to jingle works really well. Now, the other really cool thing is they make some high-tech bells as well. So these are devices that cost a little bit more. These are for 3 devices are $39 on Amazon. At least they were this week. And what these are is a device that you put on the door. The dog pushes that little button and it rings electronically. You can have the square piece in your pocket. So if you run to go do a load of laundry or you run to take a shower, and the puppy pushes that button, no matter where in the house you are, you know the puppy's at the door asking to go outside. Now, I've had people say, I don't really like it if the dog does that because they want to push the bell and go outside and chase the squirrels. Well, okay, if that's the worst thing that happens, I guess that's not so bad, because at least the puppy has a way to communicate to you that they need to go outside for housebreaking. It does take a little bit of time to teach this, but it can really well be worth it when you have a house full of dogs so that you know who needs to go out when. All right. Next, we're going to talk about normal neonatal development. We'll go through this pretty quickly. Head to tail. The oral cavity should be pink and moist. It should be a little bit red when they're crying or nursing. And if they have any sores in the mouth, that's a sign that they may have a viral infection. The teeth should be lined up appropriately based on your breed. It is normal for the lower jaw, as in this upper picture, for the puppy's lower jaw to be slightly longer than the upper jaw at this very young age, but that should correct as they get older. This is what cleft lips and cleft palates look like. These are not normal. Cleft lips are a lot less serious than cleft palates. A cleft palate is this gap in the mouth, and you can see on this puppy that there's food stuck up in there, so that becomes a problem. It needs to be surgically corrected. The cleft lips are a lot easier to fix. We just can fix those pretty easily with 1 or 2 surgeries. Teething should normally start when they're about 3 weeks old. That's one of the reasons mothers wean at 3 weeks. It's normal for puppies to start losing their baby teeth when they're around 14 to 16 weeks old, with all the adult teeth in. Anything but toy breeds should be in by 6 months. Toy breeds may be a bit later. Some puppies are born with base narrow, meaning that their lower jaw is too short, and that will, or their lower canines are too close together. And you can see in this picture on the right that that's how it looks. You can see from the picture on the left that those 2 holes are because the lower teeth are striking the upper palate. That can be painful for the puppy. So some of these puppies do need dental work. We try to discourage people from breeding dogs with this. And if you do have this, number 1, I try to breed away from it. Number 2, if you can teach the puppy to carry a tiny tennis ball in their mouth, sometimes that's enough to spring the teeth out and not require a surgical procedure to be done. The GI tract should be sterile when the puppies are born, but very quickly after they're born, they start to pick up the bacteria from their mothers. Using a probiotic helps to make sure that the right bacteria get put into those puppies. Meconium is the normal first fetal stool. We should start to see that in the first hours to 48 hours after birth. It's normal for it to be yellow, seedy, and pasty. Oftentimes you don't see it because mom keeps it clean, so you may not see it. Puppies cannot urinate or defecate on their own until they're about 18 to 20 days old, so you may have to stimulate them if mom's not doing an adequate job. Overfeeding, you'll see green or yellow stools. A foamy, bright yellow stool may mean canine herpes. A blood-tinged stool can be that the puppy is either septic or has coccidia. And fecal testing can be done even when puppies are really young on fecal flotation and ELISA tests done at your veterinary clinic. So my question to you is going to be, should you put all your puppies on antibiotics when they have diarrhea? And of course, the answer to that is no. Antibiotics are usually not appropriate for diarrhea. Probiotics are, appropriate food modifications are, but please don't put all your puppies on antibiotics. On blood work, puppies have decreased liver function until they're 4 weeks old. That's normal. The ALK phos is typically high in young puppies. That's not just a liver enzyme, but it also reflects bone growth. And puppies are growing very quickly at this age, so it's normal for an ALK phos level to be high. The BUN may be high until the puppies are after 7 days old. The urine is usually very dilute, so that's normal. And if you have a veterinary clinic that's doing blood work that includes an SDMA, that's included on the IDEX panels, the SDMA is not normal until the puppies are mature. We don't exactly have a good explanation from IDEX on why that's the case, but if you have a young puppy that comes back with an SDMA of 17, normal being 14 or under, do not panic. That is absolutely normal for young puppies. Glucose should be normal around 90. Testicles should be descended and able to feel them by 3 to 7 weeks of age. You should be able to feel them. If you can only feel one testicle, that's abnormal. And if it's the right testicle, you can feel them, not the left one. That generally means that the left one's not going to come down. That's the testicle that has the furthest distance to travel. So if the right's down and the left isn't, you're in trouble. Balanoposthitis is this green, yellow, sort of slimy stuff that we see at the end of the penis of young puppies. There's a technical term for it. It's balanoposthitis. Is the process. Smegma is the material. That's absolutely normal for young male puppies to have. Do not get excited about it. Do not put your puppies on antibiotics for this. Just clean it up. It's absolutely normal for young dogs to do this. And urinary obstructions are incredibly rare, but I have seen 2 of them in young male puppies when they're under 3 weeks of age. So it can occur. Females, on the other hand, also have that sticky mucousy discharge. Again, that's completely normal. That's just a sign of an immature vaginal tract or an immature penis. It's absolutely normal. Again, don't use antibiotics. A normal vulva should be fairly prominent and you should be able to see it pretty easily. So you want to make sure that this is what normal looks like to you. If it's recessed, that's got that little crevice or fold around there. If you have a young female with that, you want to try and keep that clean by using a baby wipe at bedtime, just to cut down on any chance of a problem. Now, typically a heat cycle will fix this. So I don't do anything with these young girls until they've had a heat cycle. Do not spay them and do not let a veterinarian do a corrective surgery on them until they've had a heat cycle, because this often will self-correct with a heat. Mostly don't spay them when they're this young. They need to go through a heat cycle. Now, there is a condition in occasional young puppies called an os clitoris. This is a demonstration of that. It's similar to the os penis, the bone in the male penis, but instead of it being in the penis, it's in the clitoris or the clitoris. Every now and then we'll see this in a young female puppy. It will sometimes be irritating to the female because that will protrude. You want to keep it well lubricated. And when she has had her first heat cycle, if it's still prominent, that can be surgically corrected. Umbilical cords, very important that we pay attention to our umbilical cords. Tincture of iodine is absolutely essential for all newborn puppies. We treat at birth 2 hours, 8 hours, and then twice a day until the cord falls off. So very important that we're treating with tincture of iodine. Hearts, oftentimes young puppies will have heart murmurs, not unusual. When the veterinarian is listening to the puppy's heart, they should be in a room that's quiet enough that they can hear the heart. If you have a very soft heart murmur, it may not be serious. It's something that the puppy will frequently outgrow. So I don't get excited about those. Those often happen because the puppy is being held up by you and you've reshaped the chest by putting pressure on the puppy, holding it in your hands. So set the puppy on the exam table, let them stand on their feet instead of being held up. Sometimes it's because they just have a more anemic blood, which is absolutely normal in a young puppy. So oftentimes any of those things will resolve. If it's a loud murmur or it's persistent past 12 weeks of age, you'll want to see a cardiologist. Oops, this slide is out of order. This is how to dip the umbilical cord. So if you have not seen this already, what you want to do is put your tincture of iodine, which is a combination of iodine and alcohol, into a small bottle, put the puppy's umbilical cord over the opening of the bottle, and then tip the puppy upside down and soak the cord with the tincture of iodine, and then put the puppy back down. So you should do that at, like I said, birth, 2 hours, 8 hours, and then twice a day until the cord falls off. The nervous system is slow to develop in puppies. Remember, their eyes and their ears are closed. When they're very young, they'll sleep 90% of the time. They will twitch. That's normal for a puppy to twitch at that age. That is all part of how things should develop. By 21 days, they should be walking and they should be actively learning. And the socialization period for puppies, the primary socialization is 4 to 8 weeks of age. Puppies, when they're first born, should be able to right themselves. They should be able to find the nipple by rooting, and they should be able to suckle as soon as they're as soon as they're born. That's absolutely normal. Hiccups and dream sleeping, both absolutely normal in young puppies, kind of entertaining, absolutely normal. Puppies do not sleep or wake in a typical pattern, so don't believe that this is true. They wake up when they want, they sleep when they want. This is a little puppy that's sleeping, and I can't find my mouse, so I'm not sure if I can play this video because somehow my mouse has been lost. So this puppy is just twitching when he's sleeping. It's just a normal demonstration. At birth, puppies cannot shiver. So until they're 21 days old, they need supplemental heat. They cannot gag. So if you try to feed them with an eyedropper, you're likely to cause aspiration. And they cannot urinate or defecate without stimulation. All those are normal. This is one of the slides that I put in that is not normal. This is neonatal ophthalmia, where there's pus that develops behind the eyelids. My ophthalmologist friends have told me that I need to tell people about this. So if you have a puppy that has bulging eyelids and the eyes are not yet open, you want to make sure that you take this puppy to the veterinarian immediately. This is an emergency. This is not something that can wait a couple of days to go in. If you see bulging eyelids, take all your puppies in, have all the eyelids open. That will not cause damage to the cornea or the eyes development. It is absolutely fine to do that. And if you don't get this done, most of these puppies will end up blind. So immediately they need to be on oral and topical antibiotics. Do not wait. Get the eyes open. Get to the veterinary clinic right away. Crying is absolutely normal for puppies to cry a certain percentage of the time, but a crying puppy that's not crawling should be warmed up and fed. Assume that it's hungry until you prove otherwise. And if that doesn't fix the problem, the puppy may be sick. You need to seek veterinary care. The ear canals don't open until 10 to 14 days of age. Absolutely normal. And until 4 weeks of age, even puppies that are white that may develop deafness are going to be able to hear. It's after that that they lose their hearing. So this is what bear testing looks like. If you have white-coated breeds, Dalmatians, setters. I have farm dogs, so we test them. This is what the computerized bear testing looks like. Is there are 3 electrodes that are slid under the puppy's skin. It's just a very small needle. We don't sedate for this. It does require specialized training and specialized equipment. So there are very few veterinarians around the country that are going to be able to do this. But it is a great test to do before you place puppies. Bulldogs, anything white-coated may end up with deafness. Now, this is kind of an interesting picture. This is what we see a lot of bulldogs and certain other breeds born with these back legs rotated. It's not the world's best picture, but it's the best picture I have. Is we can see these puppies born with rotated back feet. And at one time, people used to euthanize these puppies when they were first born. What's interesting is that if you give them a little bit of time to develop, their legs will straighten back out within a few days. Most people will do some range of motion exercises and some massage, and these puppies' legs will straighten out. The bulldog people tell me that these are the puppies that end up with the best rears. Now, I hope there's nobody on the call that I'm going to insult by saying this, but it's hard to find a good rear in a bulldog. So if this is what you're seeing in your bulldog puppies or other breeds, don't be hasty to euthanize these puppies. Let them grow up a few days and you're going to see it rotate back to normal. Nutrients for brain and eye development. These are going to be the DHA and the EPAs. We know from studies that were done at Canine Companions for Independence, which is a service dog organization we see here in the United States, that DHA is an essential nutrient for the dams to be fed during pregnancy and lactation. CCI did a study on 5,900 puppies that demonstrated that the litter number 1 out of puppies born to dams in a service dog program, 50% of their puppies were graduating from the program. And by the time the puppies were the females were delivering their 5th litter, they were down to a 25% graduation rate. So they tested 200 nutrients and determined that DHA was the key nutrient to that. So for smarter puppies, we need to supplement our bitches with DHA. Now, most puppy food and many adult foods have enough DHA in it that we no longer have to do additional DHA supplementation, which is basically fish oil that you can buy at the store. But if you're reading the label of your pet food and it's not saying it has DHA in it, you probably want to talk to your veterinarian about DHA supplementation. We know that it improves retinal development in the eye and it improves brain development. We know we get smarter puppies with this. What's really interesting about it is this has now been applied to the human side, and DHA is added to baby formula primarily because of the research that was shown in dogs for brain and retinal development. This is a study that was published in 2012 in the American Vet Med Journal about DHA, that fortification in diets with fish oil high in DHA and other nutrients implicated neurocognitive development following weaning, improved cognitive memory, psychomotor, immunologic, and retinal functions in growing dogs. Really very cool that we can do that. Now, skeletal development is another really important thing. And a lot of people feel like when they have large breed puppies that they should be adding additional calcium to their puppy's food. And the answer to that is no. Please do not do that. Puppy food has the right amount of calcium and the right calcium phosphorus balance in it to get normal skeletal growth. It actually causes more problems in skeletal development if you give too much calcium than if you use the amount that's in appropriately labeled pet foods that are meant for growth. So if you read the label of your bag, there are pet foods labeled for puppies and pet food labeled for all stages. And that's what you should be feeding to your puppies, is either puppy food or all stage life puppy food. Calcium and phosphorus imbalances create more problems than they solve. This is an x-ray of a corgi that has a growth defect. It's not just a normal corgi. That's a problem in this puppy. And obviously this puppy has a pretty significant problem with knuckling over. We see a lot of these puppies in our practice in the large breeds. So stick to large breed puppy food, or all breed puppy food if you have smaller dogs. But if you have large breed dogs, please, please, please feed the large breed puppy food. The calcium, phosphorus, and the calorie balance are meant for puppies. They're going to be rapidly growing, that are going to need skeletal development. So make sure you're doing this. However, don't use large breed puppy food on your pregnant dogs. It has a slightly reduced calcium, phosphorus, and a slightly reduced calorie amount in it. So this is not meant for pregnant dogs. This is meant for large breed puppies. The other question that people have that goes back to the DHA and EPA, and I put it here because of skeletal development, is whether DHA and EPA supplementation would cause any negative effects. And the answer to that is no. It does not cause negative effects in joint development. So it's safe to add the DHA and EPA if you feel that you need to, if your puppy food doesn't list on the label DHA supplementation. So I want to just briefly mention one of my clients' experiences. This is Travis. He's a client that came to us a couple of years ago as a new person in Wisconsin. He moved to Wisconsin a couple of years back. He raises miniature dachshunds, and he was concerned about the fertility levels in his females. So I started consulting with him, and my questions were the same 3 questions I ask everybody. Question 1 is, what do you feed? Question 2 is, what else do you feed? So are you adding raw meat? Are you adding something else to the diet? And number 3, what supplements are you feeding? So I went through the whole question list, and he was feeding a store brand of food and was getting on average of 3 puppies per litter in his 10-pound miniature dachshunds. I recommended to him that he switch to the Purina Sport 30/20, which is an all life stage diet. And he went from 3 puppies a litter to 7 puppies a litter. Now, he lives in rural Wisconsin on this beautiful farm with his beautiful dogs and his beautiful puppies and his children. So it's actually really fun to say that he went from having 3 puppies a litter to 7 puppies a litter with doing nothing else on the same 3 females, with doing no supplements, no other changes in his kennel, nothing else. He went from 3 puppies a litter to 7 puppies a litter by simply changing to a food with the micronutrients in it that were appropriate for females that were being used in a breeding program. All right. So just to summarize, we have our supply list. So again, if you want to grab your phone, just to make a quick shopping list for yourself, the bath mats, the mirrors, the enrichment center, the kids' toys, all these fun things that you can do. peanut butter, squeezed cheese, licky mats, fresh fruits and vegetables. I think those are really great things. And it's great to feed the fresh fruits and veggies to your puppies, because when you're doing that, your kids are like, Mom, I want a snack. And you're saying, honey, you should have an apple. The kids are saying, but Mom, I want a cookie. And you're like, no, honey, the dog eats apples. We eat apples. That's what we do. I think it's really important that we're giving those kinds of life lessons to our kids. And as long as you don't exceed 10% of the diet with things that are not in the commercially available dog food. So if you feed, a couple of cherry tomatoes or a little bit of melon here and there, you are not going to unbalance that important balance that our commercial pet food company, Purina, has made up for our dogs. So just thanks for the short time that we were together tonight. These are the two books that I have, Your Pandemic Puppy and the Canine Reproduction and Neonatology books, available on Amazon. Thanks for hanging in there. And don't go, because we have more to come. So we're going to have a short topic here from Will. So take it away.
Well, thank you, Dr. Greer. Once again, your great insight was a lot of fun to listen to, and I'm very informative. Before our quick Q&A, I'm going to have a quick break, but I want to share my own personal experience. As most of you know, I'm an ex-professional handler. I still have dogs. I have 2 beagles, AJ and Mia, and I have an Irish setter, Johnny, so and I also have Bouvier Clark. They're all Pro Plan dogs, and last year Johnny was a top 10 all-breed dog in Canada as a Pro Plan dog. But the biggest concern I had was Clark. Clark, no matter what I tried, he was having issues. And I called Mary and said, what are we going to do about Clark? And she suggested the lamb and oatmeal, sensitive skin and stomach. And I'll have to say, since I started Clark on that, he's had no skin issues. He doesn't scratch. His coat's coming in perfectly again. I cut him down after the National this year because I don't want to keep up his coat anymore. But I'll have to tell that lamb and oatmeal, it worked wonders on Clark. He's like a brand new dog. He always seemed like his skin was crawling, and Mary's pointed me in the right direction, and he's back to normal. He just dominates the house now and thinks he's King Kong. Okay, so we're going to have a quick, we're going to go into, if you're interested in Pro Plan, here we are. If you're interested in trying the Pro Plan Kit loyalty program for breeders offers great benefits, including savings on every purchase of Pro Plan, free delivery for large orders in most regions of Canada, breeder savings at select retailers, as well as a rebate program for purchases in stores. Great breeder puppy kits with full bags of free food, not just a sample pouch. To learn more or sign up online, please visit purina.ca/proclub. It's now time for the Q&A. Just a reminder, Dr. Greer would like to ask that you keep your questions about general topics we've covered today versus specific ones for your own dogs. We'll get in as many questions as we can and try to wrap up around 9:30. Are you ready, Doctor?
I am.
All right, here we go. Emily Bunny writes, would you always have enrichment activities available to the puppies or only for certain periods of time?
Oh, I think at night they need to sleep. So I wouldn't keep it in an area that they were sleeping in. I like to have a quiet place for them to sleep at night, and then move them out into a play area where it's bright and sunny and they have daylight and toys and fun stuff. You don't need them playing all night long. Heaven's sakes, we all need to sleep.
Kelly Berry writes, litter trays, how many pups does it service?
As many as you have. So a bigger litter, bigger tray. But I typically just use, I don't know what breed she has or how many puppies, but a small tray is enough as long as you clean it several times a day for a litter of puppies.
And Julie Plord writes, what do you think of fake grass as a pee pad?
I think it's great if you have access to it. And then there are also companies that sell real grass. They will ship you sod. I think that's kind of expensive. It works fine. It's a little harder to keep clean. I like the plastic box because I can disinfect it, and it's hard to disinfect the fake grass. So you may have parasite issues, or if you have Giardia or Campylobacter or something, it's going to be harder to clean up.
Yeah. Kelly Berry again. Heterotopic tongue. Should I be concerned?
I don't know what that is. So I don't know. I'll have to look that up.
Doesn't sound good.
No.
Okay. Brandy Black. We have recently moved to a property with well water. The well water is good, does have a higher sodium. I have noticed my litter since moving here had UTIs. My vet does not think it's the water. The current litter I have only does bottled water, and so far no issues. Have you ever heard of this well water causing UTIs?
It shouldn't, but I have to wonder if there's a bacterial component to it. So you probably should have your well water tested for yourselves and for your dogs. With you can take in a sample and ask it to be tested for coliforms. That's coliforms. It is possible you might have some coliforms in the well, that it might be contaminated, and it might not just be UTIs that they're having, but there could be other bacterial disease as well. So I'd get a coliform test on the well water to make sure.
Again, Brandy Black says, I emailed you for your ratio for the umbilical dip. How much alcohol to iodine?
I buy it already made up as tincture of iodine, so I don't mix it. I just buy the 3% tincture of iodine.
And Fry, should the bear test be done on all white puppies or pieds as well?
If you're doing bear testing, I would just do the whole litter, because you would not want to make a mistake that you had a puppy that slipped through the cracks. If you're doing a litter, they charge probably around $60 to $70 a puppy. So I would just do the whole bunch.
Brandy Black. Vitamin A at high amounts has been proven to increase cleft palates. So how do you increase DHA without increasing vitamin A?
That's absolutely true. Vitamin A excesses can, and that typically comes if you're giving either a straight vitamin A supplement or if you're giving too much liver. So typically DHA will not. And the pet foods, like I said, a lot of the puppy foods now, if you look at the Purina bag, it'll have DHA listed on it. So they are able to manage the amount of DHA without excessive amounts of vitamin A. So yes, you do have to be careful with that.
Emily Bunny writes, ProPlan large breed puppy versus ProPlan Performance. Is one a better option over the other for a litter of puppies?
It depends a lot on breed. A lot of the large breed puppies definitely need to be on a large breed puppy food. Irish setters, Great Danes, Labradors, they do better on a large breed puppy. If you have puppies with any kind of lameness, the first thing we do is switch them off of your regular performance diet and onto a large breed puppy food. So yes, it depends on your breed. It depends on their growth. So if you're seeing that knuckling over, if you're seeing them bulging at the carpus, or they seem to be limping, or they're just growing too fast, you want to slow them down with a large breed puppy food. If you have Shih Tzus, I wouldn't feed it. If you have Labradors, I probably would.
Carol Green writes, pups born by cesarean section, is there a window for normal breathing to begin before the puppy is affected physically or mentally? Should oxygen be administered in addition to the stimulation?
We typically get oxygen into the environment as quickly as we can, along with heat. They do tend to wake up faster. They tend to zoom around the incubator better. So we try to get them into an oxygen-rich environment as quickly as we can. Normal breathing can take sometimes 30 minutes to an hour. You can see them, kind of slow and irregular. And so that's where the oxygen really comes in, is if they're not breathing regularly, they're not being oxygen deprived during that time period.
Melody Marois writes, how do you treat Giardia? Giardia enters the kennel. It's very hard to get rid of.
Oh, amen to that. Yes. We typically use fenbendazole, Panacure. There's different names for it. Fenbendazole is the generic name. And you can give that once a day for 5 days. If you're still struggling to get rid of it, you can add metronidazole to that protocol. But I don't give metronidazole to pregnant dogs, and I don't give it until the puppies are at least 8 weeks old, because it can cross the blood-brain barrier and cause seizures and other pretty serious neurologic disease. So you want to be very, very, very careful with your metronidazole. A lot of people are too heavy-handed with it. They give it for too long or too much. So you've got to be very careful.
Natalie Venn, what should I feed a large breed pregnant dog?
not large breed puppy. You can feed the Sport 3020, the Sport Performance 3020. You can feed a general puppy food. Those are both fine, but you don't want to feed a large breed puppy food because it's not going to meet her nutritional needs when she's growing babies inside.
Melanie Bruce writes, what food do you recommend for food for Pomeranians? I bought your book. It taught me so much.
Well, I'm glad the book was helpful. You can feed just an all breed food to the Pomeranians. I would just make sure that you're feeding something with small enough kibbles. The kibble size would be appropriate for a small breed dog. So that would be my primary requirement would be all breed and small kibble size.
Sue Snow writes, did you say not to feed large breed puppy to the breeding female while feeding the pups?
Correct. You want to feed an all breed or an all-purpose, an all life stage food during pregnancy and nursing. They don't get enough calories. They don't get the calcium phosphorus balance that they need.
Anne Fry writes, can we get the name of those two books again, please?
Sure. I'll put the slide back up to shamelessly plug the two books.
It's a good plug. Amanda Sangster, can you share any info on giving plasma to neonates?
Yes, and we give a lot of plasma to our neonates. I think it's like magic fairy dust. I think it does some pretty incredible things for sick puppies or puppies that were colostrum deprived. We dose it at 16 cc's per puppy, regardless of the size of the puppy. Now, there's some people that dose it according to size, but the published dose is 16 cc's. You want to warm it very carefully. You don't want to microwave it. You don't want to put it in water that's too warm, or you'll denature the antibody proteins and not get the full effect. So we tend to warm it in our shirts against our bodies. We keep it frozen and we'll just take the tubes out of the freezer and pop it into a pocket and keep it warm until we're ready to give it to the puppy. Typically, if you want to give it orally, it's only going to be effective in the first 12 hours after birth. You can give it with a feeding tube. Anything after that, it can be given subcutaneously, very safely and very effectively. If the puppy is sick enough to be hospitalized, it can be given intravenously as well.
Christian Atong, around 12 weeks after whelping, female Sheltie had dark spots on stomach, appear gradually over weeks. Is this due to change in hormones? Was gradual, no fever, no crusty, no pus?
Probably. It doesn't sound serious. It's probably just the way her skin matured. Sometimes with chronic skin disease, you can see the skin getting darker, but it sounds like the skin was otherwise normal, so it's probably just hormonal.
Tasha Robertson Soden writes, if you have a bitch whose mother and grandmother both had to have planned C-sections due to not having enough hormones to push, should you automatically book the bitch for a C-section?
Wow, that's a great question. 75% of the time, a C-section is required because of something with the female, not the puppies. 25%, it's puppy, meaning the puppy's too big, it's malformed. There was a log jam, so two tried to come at the same time. Those kinds of things. So 75% of the time, it's a bitch problem, not a puppy problem. So since it's her mother and her grandmother, chances are the same thing will happen to her. However, if you want to try calcium and oxytocin used correctly and carefully, that might be a consideration. Whelpwise is a uterine contraction monitoring service we have in the U.S. I assume that they also are a service that you can use in Canada. It's a uterine contraction monitoring service. They will ship you the equipment. You hook up the equipment to the female. They will monitor her contractions with your veterinarian's input, advise you how to give calcium and oxytocin by injection. And oftentimes, if the litter size is appropriate, which means more than 2 puppies and less than 9 puppies, not less than 10 puppies, you may be successful with that ability to manage them because they can tell you what the uterine contractions are doing, if they're effective, not effective. If you're in trouble, you can see if puppy heart rates are dropping. So that might be a tool for you to use to try and avoid a C-section. Hey,
Julie Plord writes, you mentioned not to feed our pregnant bitch puppy food. Our veterinarian and my mentor breeder suggested the opposite of what you said for the last 2 weeks before whelping. I'm confused. Could you give me your input?
It's large breed puppy food that we want to avoid. So all breed puppy food is fine. Medium breed, all breed, just a general puppy food is fine. It's the large breed you want to avoid.
Natalie Van writes, how many litters should you allow one bitch to have in her lifespan? Breed 2 heats in a row, skip 1, then do 2 more?
And I think that's fine. We used to say breed, skip, breed, skip, breed, skip. But a pregnant uterus is healthier than a non-pregnant uterus. So I like to breed back to back, then give her a break, because it does take 8 months nutritionally for a bitch to get back to where she was nutritionally after a litter. So I'll do 2, then give her a break so she can recover nutritionally, DHA, calories, all that stuff, and then breed 2 more. The organizations like the service dog organizations and the state requirements here in the U.S. for number of litters, they typically don't want them to breed more than 5 to 6 litters. And it would also depend on whether she had C-sections. If she's a female that needed a C-section, you may want to pull back a little bit. I've done as many as 5 C-sections on a female, but the uterus does start to wear out after a bit. We spayed a dog yesterday at our practice that had 5 litters, and her uterus wasn't very happy at that point. It was pretty well used up. So you do want to be careful about overusing it.
Natalie Van writes, when do you start Fortiflora in the pups? First meal and then daily until they go home? 1 pouch a day for the whole litter?
The label on Fortiflora is not below 8 weeks of age. So we have to recognize the label directions tell us that. And typically, you're not going to need 1 pouch per puppy per day if you have a reasonably sized litter. Now, if you have 16 puppies, you probably need more than 1 pouch. But you can mix it with the tray of puppy food, and hopefully everybody eats uniformly enough. Just stir it up really well. But if you had a really large litter, I'd probably use 2 or 3 pouches. And yes, daily until they're ready to go home, because we want to make sure that they have good, healthy GI flora. Not only does that prevent diarrhea, but it reduces the risk of parvo, of Campylobacter, of a lot of GI diseases. We see a lot fewer of them if we have good parasite control and we have good, healthy GI tracts with good, healthy bacteria.
Natalie Van writes, I know calcium supplementation is wrong during pregnancy, but have you ever heard of giving it during whelping between puppies? Breeder's Edge Oral, Cal Plus, for example?
Yes, and we do that all the time. The reason you don't want to use calcium during the pregnancy is if you give her too much calcium during the pregnancy, the parathyroid glands, which sit next to the thyroid glands in her neck, that motivate or move calcium out of the bones and into the circulation so that she can have contractions of her uterus and so she can produce milk. You're going to suppress the parathyroid glands by giving calcium during the pregnancy. So what you want to do is wait until she goes into labor. And then, yes, you can give calcium by injection. You can give calcium orally, by powder, by gel. The gel is faster acting than the powder. The powder and the gel are not as fast acting as the injectable. So we do see stronger uterine contractions, more effective contractions, and the oxytocin works better when it's paired with calcium. But don't give it until the bitch is either in labor or very close to going into labor so that she has the good opportunity to mobilize the calcium out of her bones and into her circulation and prevent eclampsia, which is that seizure type of activity if the blood calcium drops too low, and that she has enough milk calcium for the milk production that she needs to feed her litter.
Matt Garrison writes, your webinars are amazing. Question regarding first outings. Is it commonly safe for puppies to be brought to local big box stores or smaller dog shows once they've had their first vaccinations? Or do you recommend waiting for their second vaccinations to do so?
You typically want to wait till 2 weeks after the second vaccination to know that you've got as much protection as possible. If you take them out younger than that, they probably aren't going to have full protection. And if you fall into a place where there was parvo, distemper, herpes, something that was just really serious, we'd certainly not want to see you have puppies get sick. So I'm pretty careful with not exposing puppies until after their second vaccination, 2 weeks after the second vaccination.
Elizabeth Fisher, I have a bitch who will be 3 years old and has had 2 heat cycles and is very late for her last one. Should have been in November. What could be the issues as we are waiting to breed her?
Well, it can be a number of different things. Sometimes it's daylight. Female dogs are not as dependent on daylight and length of day as horses, but they are daylight dependent. So make sure she's getting plenty of full spectrum light. If you have cold weather and you can't get her out into the sun, make sure the windows are not closed with blinds or curtains. Make sure she gets enough daylight. You can buy full spectrum light bulbs to put in the house. So keep her where there's at least 14 hours of daylight or full spectrum lighting. You want to make sure she's on an appropriate diet because that makes a big difference. I see a fair number of females that have kind of stalled out. And if we put them on a B vitamin supplement, and it's hard to explain why this works, but a B vitamin supplement like Be Strong, they'll pop into heat within 2 weeks. So really it's heavy on nutrition and daylight. And if that still doesn't do it, there are a couple of drugs on the market that you can talk to your veterinarian about using to bring her into heat. But I really like natural heats better. They're typically a more fertile heat.
Carol Green asks, what Pro Plan kibble do you recommend for toy breeds? Is there a 30-20 mix for small dogs?
I'm going to have to defer to the Purina people for that kind of detail. I don't know if anybody's on that wants to hop on or if that should be better answered by email.
Yeah, I think nobody's on. So
Okay.
We'll get back to you with an email on that one,
Right.
Carol. Jennifer Clark, would Samoyeds be considered large breed for puppy food?
I would, yeah.
Victoria Tack, is it possible to skim past lab values once again? I was handwriting notes and couldn't get them down fast enough, so I will take a photo.
I'll scan back to those pictures, yes. It's also, there's quite a bit of information in the book. So if you're really looking at in real detailed information, then yes, let's see if we can get all of them. Okay, we'll go back to this and I'll put the slides up and just move through them slower.
Okay. All right. Priscilla Twombly writes, what do you recommend for a blind singleton puppy in terms of enrichment? He's now 14 weeks. Is it very rare in my breed?
Wow, a blind singleton, that is tough. There's actually a book called Living with Blind Dogs. You can buy it on Amazon. It's pretty helpful. What do I recommend in what regard? Mostly that you keep the environment as consistent as you can so that the puppy memorizes what he needs to navigate around. If you move things around all the time for that puppy, it's going to be really difficult for him to trust his surroundings. So don't leave a chair sitting out. Don't bring the groceries home and set them in the middle of the floor. Don't do things that are inconsistent. You want to be as consistent as you possibly can be so that puppy has a chance of memorizing his environment.
Janice Lamontagne writes, can you use tincture of iodine spray?
You can use the spray, but I still dip the cord. So I put the spray into a bottle where you can actually completely encircle the cord and make sure it penetrates down into that tissue. You want that cord to dry up. I had a very bad experience on my own. At one point, I was using chlorhexidine instead of tincture of iodine because that was the current recommendation. And the cord on the puppy got infected and the puppy was normal at 2:00 in the morning. And when I checked on at 4:00 in the morning, he was dead. I opened him up and checked him, and that's what it was from, was an infection into the peritoneal cavity. So I am really, really, really adamant about using tincture of iodine as a dip.
Cindy Bazin asks, do you feel a combination diet of Pro Plan and raw would impact fertility in either males or females?
I absolutely do not recommend raw. I know there's a lot of people who really are fans. And if you really feel like you must feed it, please don't do it during pregnancy. We can see pyometras from the bacteria. We can see infections in the uterus from the bacteria. We can see parasite migrations. My favorite story is I had a number of years ago, I was in charge of the eye clinic at our local dog show. And I was in the room in the dark with the ophthalmologist, as most of you probably have experienced. You stand in the dark while they're looking at the eyes. And during the exam, and this was before raw meat diets became a real thing, he was the ophthalmologist from the vet school, Dr. Miller, here in Wisconsin. And he was looking at the retinas of the dog with his magnification. And he took a step back from the table and he looked at the client and he said, "How long have you been feeding a raw meat diet?" He didn't ask if she was feeding one. He said, "How long have you been feeding a raw meat diet?" And you could hear the air leave the room as she gasped. And she said, "What do you mean I'm feeding a raw meat diet?" He said, "You are." And she said, "I am." He knew from the parasite migration scars in the retinas that she was feeding raw meat. Do I need to say any more than that? I mean, really? Doesn't that seem like a terrible thing to have happen to your dog? So why would we take a risk on that of bacteria, parasites, pyometras, septic pregnancies, puppies that don't get the right nutrition, so they don't grow normally? I mean, there's just so many reasons not to feed raw. I could go on and on, but I'll let it go back to let's feed commercially available kibble that we know is compounded correctly.
Christina Grandmont asks, if introducing scents during ENS, how many scents should you start with not to overstimulate the puppies? And how often do you add new ones? My breed is Basset Hounds.
I think that's brilliant. Of course, you want to do this with Basset Hounds. The recommendation is 1 new scent a day. So, and just for a very brief period, you don't want to, like you said, overstimulate them. So, whether it's soil or whether it's cinnamon or whether it's bird wings or, some kind of fun food, chicken, whatever. You just want to do 1 scent per day for a very short period of time. And they'll kind of tell you if they're interested. I mean, if you find something that's offensive, we put fingernail polish on the puppies frequently to make sure that we can identify which puppy is which when we're sending them home. And they don't like the smell of it. So you'll know pretty quickly if they're offended by it.
Patricia Bellevue writes, should I stop using freeze-dried liver completely as training treats for my female about to be bred to reduce risk of cleft palates?
Yes. Yeah, I would not feed any organ meat when you're getting ready because vitamin A is the vitamin that causes an excess, and A, D, E, and K are the 4 fat-soluble vitamins. So feeding too much of it in advance will allow it to build up in her body, and she may end up with a toxicity. B and C, vitamins B and C are water-soluble, so excesses get urinated out, but A, D, E, and K end up causing potential toxicities. So yes, I would avoid that excessive liver. So find another treat. Carrots, apples, good stuff.
Melody Merwa, I have an enclosure of synthetic grass, so it's hard to disinfect. Which product do you use for Giardia?
There really isn't a product that will effectively kill Giardia, so you may have to just get new synthetic grass in a small area when you've got young puppies. And then fenbendazole would be the drug to treat if you do have Giardia in the puppies, but there really isn't a disinfectant that kills Giardia.
Sandra Schumacher asks, do you recommend folic acid to prevent central line defects, cleft palates?
The general recommendation is yes, especially in the brachycephalics. The only published dose we have on that is 5 milligrams per dog per day. And the typical capsules come as 400 micro. So that would be 12 capsules a day. It's pretty hard to get that many into a small breed dog. I don't think you need that much, but that's the only published dose we have. So yes, if I had brachycephalic dogs or a line of dogs that had a history of cleft palates or other midline defects, meaning open fontanelles, open abdominal walls, those kinds of midline defects, yes, I would definitely be supplementing with folic acid.
Sandy Kniff writes, for a 20 to 25 pound dog, what is best for a pregnant female for food, and when do you start giving it?
I would just use a general puppy food at that point. And dogs don't need to gain any weight during the first 5 weeks of their pregnancy. There really isn't any significant growth of the puppies that requires that. After the first 5 weeks, so the last 4 weeks of the pregnancy, they should increase their food about 10% per week. So depending on how big her litter is and how much weight she needs to gain. If she went into the pregnancy a little heavy, if she went into the pregnancy a little thin, you can adjust accordingly. You should be able to feel her ribs during the entire pregnancy, but not see them and not feel like it's feeling the back of your knuckles when you're feeling her. So you want to increase her food appropriately so she doesn't go into labor chubby or she doesn't go into labor underfed. So it's about a 10% increase per week. Switching from adult food to puppy food will automatically increase that for the first week or two after you make that transition.
Shelley Duzak asks, what age do we introduce fruits and vegetables to puppies? Also loved your books.
Glad you like them. I started around 6 to 8 weeks of age, assuming that the puppies have good form stools, that they're weaned, that they're, really good, solid eaters. You don't want to throw anything into the diet that's going to upset their tummy and cause them to go off food if you're just in the process of weaning. Now, my corgis wean really easily. At 3 weeks, man, they're ready to start eating solid food. My farm dogs, 6 weeks, some of them don't even want to look at solid food. They still want only their mama's milk. So you have to know a little bit about your breed and your lines to make that detailed decision.
Brent Spur asks, anywhere in Canada to get plasma? Also looking forward to your presentation at the Potomac.
Oh, yeah. Potomac is going to be fun. I don't know about plasma in Canada. There's a couple of blood banks in the U.S., so you would want to look up animal blood products or blood transfusion or fresh frozen plasma. I would just Google and see if there's any place in Canada that can do that. I don't know if they're allowed to ship that across country lines because of the regulations on importing certain products. So you'll have to find a Canada source. If you can't, if you have a large breed dog in your kennel or you have a friend with a large breed dog, you can draw enough blood from them. It should be a male dog that hasn't, or a female dog that's never had puppies because of the risk of antibody formation. So if you have a buddy with a Rottweiler, hey, ask if your vet can draw blood and process it into plasma for you. It's putsy, but it can be done.
Sandy Kniff. Female did not have enough milk. Then her one nipple had coke-colored milk, but she did not seem to have mastitis. What could it be, and would that happen again?
So not enough milk can be genetic. I have had a line of dogs at my house that have done that. So I've tried to breed away from that. There are medications you can give to help bring in the milk. Oxytocin injectable lets down the milk. Metoclopramide, which comes as either an injection, an oral tablet, or a liquid, helps to produce milk in the mammary glands. So those two drugs can be given simultaneously. They're both prescription items. The other things that I do to improve milk production are going to be make sure she gets plenty to drink. So maybe salt her food, add broth or canned food to her diet so she drinks more. You can feed bratwurst. I don't know why bratwurst works, but it does. Root vegetables and oatmeal are used on the human side. So again, you can feed those to your lactating females. And the coke-colored milk is usually, it happens every now and then, even without mastitis, if the gland just isn't producing adequately. So you can kind of stimulate the female, milk that out, and see if you can get normal milk to come in behind that.
Miriam Colomb writes, do you give calcium during delivery?
I do if I have a slow delivery or puppies that aren't coming out as quickly as I want them to be, or a female that seems to be stalling. Injectable works the fastest. The gel works second fastest. The powder or things like Tums don't work particularly well at all during labor and delivery. So you want to have either the injectable 10% calcium or the gel, which will kick in pretty fast. And it is amazing to me how much of a difference calcium can make.
Natalie Van writes, do you recommend an X-ray or ultrasound prior to whelping to count puppies every time?
X-ray is the only way you're going to get an accurate count. Ultrasound is like a movie and the puppies are moving around. It can be really hard to tell who you've counted and who you haven't. An X-ray will give you a more accurate count as long as you're under about 12 puppies. I recommend it every time unless you're planning a C-section. If you're planning a C-section, okay, fine. You don't need to because you're going to assume your vet's going to look everywhere and take out all the puppies. But actually, it doesn't always happen, unfortunately. But yes, if you're going to whelp at home at 2:00 in the morning, you want to know, is she done or not done? And I have people that call me frequently and they'll call and say, well, there were 8 puppies on the x-ray. Are you sure there were 8? I'm like, yeah, I'm sure there were 8. And they'll say, well, they've only had 7 and she acts like she's done. Well, I'm telling you, there's still an 8th one in there. And lo and behold, there will be. So get a vet that can give you good puppy count x-rays. Work with them on taking in the dog fasting, taking 2 x-rays, one with the right side down and one with the left side down. Make sure she's had a stool before she has the x-ray taken. If she doesn't, use your match trick where you put matches in the rectum so that they'll go out and have a stool. Do everything you can to get an accurate puppy count. It's going to save you maybe your bitch and definitely your puppies.
Priscilla Twombly, to improve fertility in a bitch, should you feed ProPlan Sport 30/20 full time until they are retired, or wait until they are planning to be bred?
I think it's a great all-purpose diet as long as the dog doesn't get too heavy on it. It is fairly high in calories. So if you have a Labrador that doesn't move around very much and she's going to get overweight on it, then I wouldn't feed it all the time. If you have a really active dog that you have trouble keeping weight on, or you can feed a slightly smaller amount, you're going to find the micronutrients and the components of that diet are going to give you the best fertility of any product that Purina has on the market.
Cindy Basin writes, I have a bitch that required calcium supplementation after whelping for all 3 litters. The last litter I had to wean early as she was super aggressive towards the pups. She could not be left alone with him. But once weaned, she would play and interact. Would that be a diet issue or genetic?
Well, we believe it's genetic in the mini bull terriers, but I think it probably is genetic in other dogs as well. Bernese Mountain Dogs tend to have some trouble. There's definitely some breeds that I think we see calcium problems with. But if she needs more calcium, just give her more calcium. I mean, not everybody has the same metabolism. And if she's lactating heavily and needs more calcium and she's grumpy without it, heck, give her calcium. It's pretty hard to over-supplement calcium orally if you use a reasonable amount. If you give too much during lactation, she won't develop high calcium as a result of it. So be reasonable. I mean, don't give her, 10 grams of calcium a day. But depending on the breed of dog, somewhere between 500 milligrams of calcium and 1,000 milligrams of calcium a day may be completely appropriate for her. I don't know what size she is. I don't know what breed she is.
Taylor Blanton writes, is there a time limit on laboring? When would you be concerned that it's taken too long?
My rule of thumb is hard labor for more than 2 hours before the first puppy or an hour between puppies is too long. Now, she may rest a little while, but if she's actively pushing and not making progress, and it's more than 2 hours on first puppy, more than an hour on a subsequent puppy, you need to go in and get help. So go to the vet clinic. Hopefully you have somebody close by enough, or you have your calcium and oxytocin. I never give oxytocin until after the first puppy is born. And I give tiny, tiny doses of oxytocin because Whelpwise has taught us that the label dose on the oxytocin bottle is way too much. So scale it back to probably 10% of what you think it should be, and you're probably going to get a better outcome.
Sue Snow writes, do you recommend any added vitamins to the breeding female before and or after the litter is born? Typically,
if you're feeding an appropriate all life stage diet or the Purina Sport 30/20, that should be nutritionally complete. You shouldn't need anything else. Like I said, sometimes we'll see B vitamins help to improve the appetite. Sometimes we'll see them help to bring a bitch into heat that hasn't come into heat. But in general, that's all you need. And that's all I feed at my house is just an appropriate diet for the life stage of my dog. I don't give a lot of supplements. I give fruits and veggies, but I don't give a lot of supplements.
Lynn Oslach asks, I have a first-time mother, C-section, who will nurse puppies only when someone is with her. She does not go into the whelping box when alone. We know this by our video feed. She is happy to nurse when asked. It's now 2.5 weeks in, and she continues with this. Have I taught her this? Do you think it will change with another litter?
You might have spoiled her just a little too much. We do see dogs that don't want to be with their puppies because they don't think they're a dog. They have been spoiled a bit. The adapto collar, which is the pheromone collar, that can help her maternal skills. Oxytocin, you can get it as a nasal spray. That will improve maternal skills. Calcium can help improve maternal skills. Sometimes, I mean, it's hard to say what she'll do next litter, but those are things I would try to improve her maternal skills. And just sometimes you just have to kind of make them do what they need to do. Is you just have to put them in the box where they can't get out and say, I'm sorry, sweetie, these are your babies and you need to take care of them. As long as she's not going to cause them harm, and you can keep an eye on her on the camera, you're probably safe to just make her stay in the box.
Christine Tremblay asks, what can you do to prevent eclampsia after the whelp?
Eclampsia typically happens in small breed females with huge litters, the 10-pound dog that has 7 puppies, that kind of thing. So at the time that she whelps, then you can start increasing the calcium if you need more than what's in the dog food. You can start to see early signs of eclampsia. She'll start to walk a little stiff-legged. So you want to bump up the calcium in a gel form or injectable form pretty quickly. So basically, if she's lactating heavily when the puppies are at their maximum needs, which is around 2 to 3 weeks of age, and she's a small breed dog, you potentially need to add additional calcium over what the regular dog food has in it. So just be careful with that. They make calcium gels that are pretty tasty. They make calcium tablets. They make calcium powder. There's a lot of good calcium products on the market.
Martine Couture, I never... I don't understand this.
It's a Chinese crested that has a floppy ear.
Yeah, I'm 1 year old. I still tape, but I never experienced this before. I don't know if I should give up or could there be a supplement I could try? I currently supplement with collagen.
There aren't any supplements. That's all cartilage, and people do want to add calcium and things like that, and that certainly doesn't help. There used to be a product on the market that you applied to the ear that had like chili peppers in it that was really irritating to the skin in an effort to kind of scar it and help it to stand up. Really, taping is the best you can do, and just give it time. But I am not aware of any supplements you can do. I have been known to shave the ears, and I don't know if this is a crested. I don't know how much hair she has on her ears, but sometimes shaving the hair off the ear, even though that makes it hard to show them, it lightens up the ear enough that the cartilage becomes less drawn down by the hair. And so taping it and shaving it can help. I've occasionally had to tape a corgi ear. And of course we do ear crops, so you don't have to worry about that in Canada. But when we do ear crops, it just takes sometimes a long time for those ears to stand.
Natalie Venn, how often do you allow your dogs to mate? Mine want to mate 6 times a day for 10 days. I limit them to twice a day, but they drive me nuts.
Yeah. Once a day is really going to maximize your sperm production. Any more than that, you're going to start depleting his semen reserve in his epididymis. So more than once a day, I wouldn't do. They don't need to breed that often. Yes, I'm sure it's recreational at that point and they're having a good time, but it might be just a little too much for both of them. So you probably need to show some self-control. The other hard part about it is when you breed over a 10-day period of time, you don't know when she's actually due to have the puppies unless you progesterone timed her. So really you only need one mating at the right time with good semen quality and a good semen delivery to get a litter. We do it all the time with frozen semen. So obviously 60 breedings is more than you need.
Jean Robertson writes, is dehydrated lung okay for treats for a bitch you hope to breed, or does it fall under the same blanket as dried liver?
No, it does not have the vitamin A in it that liver has, so dried lung should be fine.
Brianna, I have a Vizsla bitch, 30 days in pup. She is a very fussy eater. 2 questions. She will usually eat well after a good long run. Should I be restricting her exercise? And if she is resisting food, what do you recommend? Kibble is a no-go right now. I've been feeding ProPlan cans, and sometimes that's okay. Right now, she's eating homemade stew made by me specifically for her.
Well, good for her. She's got you wrapped around her little finger. And a lot of bitches do lose their appetite at around 30 days. It is the most consistent sign of pregnancy in the bitch is a loss of appetite between the 3rd and 5th week of pregnancy. So absolutely normal. It's just like morning sickness for us, so not unusual. I would give her enough exercise that she stays fit, but not so much that she overheats and increases her body core temperature. If you're exercising outside, I think that's unlikely in February and March, so I think you're probably okay. But don't let her get too hot. And sometimes you just have to feed them what they'll eat, because food is better than no food. Dog food is better than human food, but food is better than no food. So if you have to mix scrambled eggs or hamburger or chicken or something with her kibble to get her to eat, hey, sometimes that's just what you have to do to keep her going. Fran Smith was speaking last weekend at the event I was at, and she's pretty adamant that she doesn't like to keep females that don't eat well. I have not been that way about it. But typically in my experience, and this is probably not well researched, but the bigger the litter, the less well bitches eat. So I think it has to do with hormone levels. I think it has to do with gastrin levels in their stomach. But if she's not eating well at 30 days, she might be giving you a dozen puppies. So better hang on for the ride.
Asher Robertson Soden, how much do you feed your corgi bitch on 30-20?
Oh, it depends on the bitch. It's typically around a cup twice a day, but I have some bitches that are easier keepers. We have one named BB for Baby Bell, but for a little while we had to call her BB for Big Butt. So it just depends on her metabolic rate and her activity level. So essentially, it's about a cup twice a day, but if she's older and spayed, it's going to be less. If she's young and really active, it's going to be more.
All right, it's one last question, looks like. Sarah Biting, when giving high calcium, do you need to supplement with phosphorus and vitamin D?
Most of the time they come with vitamin D along with the calcium. So typically, yes, the products that contain calcium will also contain the phosphorus for absorption. So you're typically going to be okay without having to seek out phosphorus and vitamin D separately. It's typically going to be all in one supplement.
Okay, I'm afraid we've reached our 9:30. I think that's enough questions for tonight. And once again, it's been fun, Dr. Greer. I'll enjoy spending time with you and talking back and forth.
Great.
I'd like to thank everybody for participating and to ProPlan for making tonight possible. And how much is that dog in the window?
All right. And here's my contact information. If anybody needs to get a hold of me, feel free.
Good night, everybody.
Good night.